The age in which we see these patients has gone certainly younger, so many preteen and definitely older as well. I mean, it's not just your college kids that we see who maybe had too much to drink. The amount of overdoses that we see, and it's not just alcohol, a lot of times it's polysubstance, has increased at an alarming rate, even in our little South Kingstown community.
One in 5 people experience a mental health issue. So the likelihood that you or I are going to know someone in our family, in our circle of friends that are struggling, is palpable. Youth Mental Health First Aid is a mental health literacy course, much like CPR, that teaches people the basic skills that they need to be able to identify the most common mental health disorders and what to do about them.
The Youth Mental Health First Aid training to me is so vital because half of the mental health problems among everyone start by age 14. The average set of anxiety is now down as early as age 7, whereas 4 or 5 years ago we thought it was age 10 or 11.
The children are often sent from schools to the ER because of lack of services in the schools to evaluate them for a mental health crisis. And what our role is to divert them from going to the emergency room because it is so traumatic for them, especially when they're depressed.
8 for 80 is probably the ultimate upstream effort that we're launching here in South County because it starts at birth. And it works to implement these 8 critical skills for mental well-being that will serve people their whole lives.
So one of the important facets of the 8 for 80 project is that it really is raising a consciousness in parents about the importance of attending to mental health needs. Parents don't automatically think to teach their children about emotions or to teach their children about how to respect themselves or respect other people. It's a program that's really designed for prevention as opposed to intervention.
It's critical that we get community support, that we get your support for these programs that can make such a difference in the lives of children as well as adults. And we can continue to carry on that very important work that is going to have tremendous payoff over time.
Family that's left behind with that kind of tragedy, my heart just goes out to them because they're never going to be the same, ever. And whether it's my personal experience with losing my daughter to an overdose, or watching somebody else going, oh my God, you have no idea what you're in for the rest of your life. Never having this child to have, to hold, to love again is just unfathomable.
We're here tonight to ask you to support Healthy Bodies, Healthy Minds, to support your community. Your gift will ensure that we can continue to teach parents how to care for their children and in the end contribute to a better community. So I'd ask you to be as generous as you can be.